So we have this insulin carbohydrate ratio which we discussed earlier. As we said, you start with the rule of 500 divided by total dose, and suppose you see then if given patient, for example, is using 50 units a day, then it becomes 10 becomes the insulin carbohydrate ratio. That means 1 unit of insulin will utilize 10 grams of carbohydrate in that given individual. As I said, this will vary tremendously from patient to patient, and of course it may vary at certain different timings in the same patient during the day, or over some months or years it can change in a given patient. So patient needs to look at it or evaluate it periodically. In order to evaluate whether you are truly using the correct insulin carbohydrate ratio in a given patient, you really have to follow this procedure and do it once in a while. That is, the patient has to select a low fat meal which is less than 10 gram fat, because the fat is metabolized very slow and therefore it will overlap or it will vitiate the calculations in insulin carbohydrate ratio calculation, and therefore you go for a low fat meal, and then you make sure the carbohydrate content are accurate so that the ratio you get will be further accurate, because if there is a mistake here, obviously it will be transferred into the final calculations. And of course you monitor blood glucose every 2 hours for next 4 hours, and you see that the post meal glucose is not more than 40 to 80 milligram higher than pre-meal glucose. That means the amount of insulin injected is a correct one, and at 4 hours you check the blood glucose and see that it has come back to almost target range. So the peak prandial allowed is between 40 to 80 milligram above the pre-prandial value. The post-meal glucose should be within this range, and of course it should come back to target range after 4 hours. And if you have to do it thoroughly, you do it on 2 or 3 different meals and assess the variation there also, and then the patient knows for sure what is his or her insulin carbohydrate ratio. Exercise is very important factor, and pump patients are taught beautifully to take care of the exercise related variation. When you do that, most pumps have a provision for lowering the basal rate during exercise, what is called temporary basal rate, which can be 10 to 50% lower, and there is an adjustment easily available on the pump to do that. See, and you can start this lower basal rate about 20 minutes before exercise and continue for about 2 to 4 hours after exercise. In every patient, the exercise effect is different. Some of them usually is soon after exercise, that is within 4 hours, but do remember that some of them the exercise effect comes after 6, 8 hours or up to next even 24 hours. So you have to be fully aware of these kind of variations. In some patients, instead of using a lower temporary basal rate, you may choose to disconnect the pump totally. It is advisable when there are contact sports, because there are chances of injury or damage to the pump, because like football or this kind of games. And of course, then you disconnect not more than 1 hour. In case you do that in type 1 patient, then a small dose will have to be injected subcutaneously, because there is a possibility of the advent of sudden ketoacidosis when the patient is without any insulin for more than an hour or so. The day when activity is omitted, or there is an intercurrent illness like cold, cough, fever, the patient may need even a higher basal rate. So, and of course, those days the exercise also does not occur, so patient has to be aware of this kind of daily adjustments. The basal rates again need to be evaluated. Like we have evaluated the boluses, we have to evaluate the basal rate. See, for any evaluation, the patient should be free from unusual stress, infection, intercurrent sickness, or recurrent hypoglycemia. Then your evaluation is going to be valid, so you make sure that these things are not present. Then what you do is, for overnight basal rate evaluation, what you do is again have a low fat meal as we discussed earlier, so that the basal is not altered by the fat which is metabolized slowly. The preceding exercise also is omitted. Any alcohol in the meal is to be omitted, because this will alter for that particular day or experiment that you are doing the basal rate calculations. and therefore in this situation then the starting blood glucose when you evaluate basal have to be around 100 to 150, so that you see in case you give lower doses it should not go very high. So patients should be under reasonable control when you evaluate the basal rates. So you start about 5 hours after a low fat meal, and you see the starting blood glucose, start checking blood glucose every 1 to 2 hours. You see for night time bolus evaluation, you check blood glucose 5 hours after dinner bolus, bedtime, midnight, 3 a.m. and 7 to 8 a.m. This is not to do with basal but a bolus evaluation at night. The optimal basal rate is if the blood glucose does not increase or decrease by more than 30 or 40 milligrams. So it oscillates, but within this limit. If it is oscillating, means the basal rate is correct. If the blood glucose is high, obviously you increase your basal. If it is lower than what your targets are, then you decrease the basal. So you, as we have discussed earlier, you evaluate the basal rate. You see, when you need to adjust if blood glucose fluctuations exceed 30 to 40 milligram, then you know that the basal rate is not correct. And then of course we adjust by 0.05 or 0.1 unit per hour at a time and continue evaluating each whole day or segments of the day that you are having different basal rates. Or increase or decrease the basal 1 to 2 hours before the rise or fall of blood glucose. So the latent period required for insulin to be effective and reflect on your basal is 1 to 2 hours. So you change that before the time that blood glucose is known to rise or known to be low, and change one time frame. So if you have 4 time frames like I showed you in the basal, then at one time you address one particular time frame and adjust your basal rates. Once this is done, the basal rates sometimes stay constant for months or years in a given patient, so that once he has learnt about this, he can carry on beautifully without repeating these experiments too often. The reassessing of basal rate is only required, you see, if there is a change in body weight. If somebody gains 10 kilo weight or loses 10 kilo, the basal will change. Even the boluses will also change, because both the sensitivity will also change. And if the physical activity level changes, the change of job, the change of shifts are there. If the patient is pregnant, the basal as well as boluses will change. And if there is recurrent high or low pre-meal blood glucose, then again you will have to change the basal rates.
Because I have done a food groups earlier, so then it struck me, ma'am, that how you decided you want.
System में crash हो गया.
No problem. I have all this ready.
Tomorrow I have teaching lecture. Just now he called me up. He said, "Mama, get